Hi, my saltines, and welcome back to Senior and Living Today. I'm Courtney Jones, your caregiver's caregiver. This channel is Senior and Living Today. If you are new here, welcome. And if you are returning, you are a saltine, and I say welcome back. Senior and Living Today is a channel for those 55 and over and those who care for them. So welcome to Senior and Living Today. Today's topic has to do with hospital advocacy. We had a discussion before about when you're home and you're sick, about, checking in with someone and letting them know what your symptoms are, what you're feeling, in case something happens and you become unconscious or your condition deteriorates. When someone takes you to the hospital, they're going to say, well, what was his symptoms? How long did he have them? And you kind of want someone who can know and speak up for you. Well, I wanted to let you know that doesn't just apply when you're sick at home. The reason why I say this is because being in a hospital can be a dangerous place. Nurses and doctors are just so understaffed, and it appears that's getting worse by the day. If you're listening to the news and you're listening to headlines, hospitals are in trouble. Lots of hospitals are closing, which are increasing the number of patients at the existing hospitals. And if you know anyone who's a nurse, they're going to tell you how overworked they are. Well, that's putting your people in danger potentially. So today's topic is discussing hospital advocacy and why it's important. Back in the day, when you used to go to the hospital, let's say you were having a C-section, or you were having a hernia repair, or you were having a hysterectomy or a mastectomy, you would be in the hospital for days, 5 days, 7 days. And as each day went on, you got a little better. And so the nurses had a variance of the level of patients they took care of. Some were fresh out of surgery or a fresh admit for observation for something critical. And then they had patients that were 2 days post-op, 3 days post-op. Oh, now they're moving around. They're doing a little better. And they're there just, getting their food brought in, and they're resting. They aren't needing a lot of assistance. They need their medication every 4 hours, 6 hours, or 8 hours. And that's all they need. They're getting better and better. And that used to be how it was. They needed less and less care as the time went on. Well, that was back then. And you would drive up to the hospital to go see your person, and there would be people out in front of the hospital, and they'd be smoking cigarettes because they were well enough to go outside now, or they would be sitting out in the gardens and looking at the flowers because they were feeling better. So they could just sit outside and get some fresh air, and then the staff would bring them back in. Well, that was then. That kind of stuff isn't happening now. If you know where that's happening, comment down below, because I have not seen it. I have seen stressed out, overworked, overburdened, overpatient load nurses trying to do the best they can, and they're basically at their wits' end. So you would see patients over time who were very ill, and then they would get better and better. Now that doesn't happen. The hospitals kick you out, and I don't know another way to say it, because a lot of times they want people to leave the hospital when they're not ready, when they don't feel ready. So that's why I'm saying kick you out. Of course, the hospital is never going to say that to you. We're kicking you out, but that's what it is. Sometimes your doctors feel like you need more time, and insurance won't allow you to have it. unless they say, well, maybe we could say we're waiting for them to pass a blood clot or waiting to see if XYZ, so that we can let them stay an extra day. So they almost have to be dishonest to get the patient exactly what they need. So that's a real sad state of affairs, and I don't blame the doctors for that. I blame the people who own these hospitals and the insurance companies who have decided they know how long it takes for a person to feel better. I know people that have had mastectomies that have gone home the same day. The same day. And in my mind, I want to go, where do they do that at? And the truth is, we do it right here. That did not used to happen. I used to work in a hospital. That did not happen. And I've been a patient. If you had a hysterectomy that was an abdominal cut, you were in there 5 days, 7 days. Not anymore. Not anymore. No, it's to me, it's terrible. But it's why you need an advocate, because you are at your most critical state and they keep you for a day and you're on your way. No matter what kind of insurance you have, as terrible as it is. So if your nurse, let's say, has 5 patients, and these 5 patients are all critically ill, who do you think is going to get the service that's needed? The person that is going to get the care that's needed is the person who's making the loudest request. You know, the squeaky wheel gets the oil kind of thing. And so what I'm saying to you is you need someone who is going to be there with you, ideally the entire time that you're at the hospital, 24 hours a day, whether they move a recliner into the room for you to sit in, or people in your family take shifts being there. You need someone there for you, because the nurse is going to come to the squeakiest wheel, because he or she can't be in 2 places at once. And so you need an advocate. You need a person to help you who also is not knowingly helping the nurse. I've been in a hospital situation where I was in so much pain I could not speak. My advocate was able to go to the nurse and say, hey, she is in so much pain. Her pain meds were due 20 minutes ago. Can she have it now? Because, you know, as if you're in pain, the longer you go past when your pain meds are due, the more intense your pain gets, and it's harder to get back on top of the pain. Well, I was so thankful that I had my advocate there, because I could not speak up for myself. After a surgery, I needed help walking. It said on the board, you know, they have the boards in your room where you know, it lists what meds you're on, what, you know, when you're supposed to have a shower, when you're supposed to walk up and down the hall to see if you have, you know, if you're getting your mobility. My walk never came. My walk never came. Day shift said I was getting a walk. Night shift said I was getting a walk. My advocate had to say, hey, where is her walk? Someone to keep them on task. And when the nurse couldn't do it, a second person came, and the 2 of them were able to walk me down the hall. So to look out for your person, you really need an advocate. You really need a person that's there in case the nurse can't be. You really want to ensure that your person is not just taking up a bed, that they're getting the care that they need. And while you're helping them get some water, or you're helping them go to the restroom, it's helping them. You know that they're being taken care of, and it's helping the nurse, because the nurse might be next door or down the hall with someone who has no one there. And in these times, unfortunately, you want to be there to make sure that you're getting the best out of your hospital stay that you can, that you're making sure that your person is not uncomfortable and in pain, or if you notice they're deteriorating, your nurse might not know it. She might be next door, and by the time she gets back to your room 2 hours later, it's too late. So I really want to encourage you, if you know someone who's, let's say, got a planned surgery, got a plan something where they're going to stay overnight and they're not going to just let them go, because there's a lot of, you're barely awake from anesthesia, and they have you waiting at the door with a blanket over your lap, waiting for your ride to pull up to the door. But if they are going to keep you, I really recommend that you talk amongst your friends, your family. I've had both there for me, and I'm so thankful. And to my friends, you know who you are, that have been there and come in and out and been there for me. So if you have something planned where you're going to be in the hospital, also discuss with your people who can come. Oh, I can come, right after work. Okay, great. You'll be there from 4 to 7. Okay, who can come after that? I can come after I put my kids to bed. Great, you'll be there after 8. That kind of thing. Work it out so that you have someone there looking out for your best interest while you are there, so that no service that you have been promised is missed, no medication is missed. If they try to give you one thing and you're like, your advocate is like, no, her doctor made rounds and said they're switching her to this. Oh, that's right. It's the little things that are big things. So make sure that you have an advocate there that's making sure that everything is being provided for you that you need. Okay? I hope this has been helpful to you. I hope you will like and subscribe to the channel, and also follow us on TikTok, which is now X, and Instagram and Facebook. You can find us there. I hope you will visit our website and join our newsletter there so you don't miss out on anything. I hope you will also contribute to our Ask a Question segment. We do have an Ask a Question segment. You can submit that in and I will answer your questions. And we also have the Super Senior segment. So send to me your Super Senior nomination and I will discuss that on the channel as well. We all have to look out for each other. So I thank you for tuning in to Senior and Living Today. And I look forward to seeing you next time, right here on Senior and Living Today. Goodbye.